Hello, my name is Julia Downing and I'm the Chief Executive of the International Children's Palliative Care Network. And I'm delighted to be able to talk to you today about the role of the nurse in paediatric palliative care. So just a bit of background on myself. I'm a nurse. I have a PhD looking at the impact of education on palliative care. And I've been working internationally in paediatric palliative care for the last 30 years. So I'm going to share some of my experience in terms of the role of the nurse in paediatric palliative care. So what are we going to look at? Well, I'm going to start by just reminding us of the philosophy of paediatric palliative care. Then we'll be thinking about what is the need for paediatric palliative care and trying to look at why the role of the nurse within paediatric palliative care is so important. We'll just touch on some of the principles of paediatric palliative care, and then we will look at the role of the nurse and some of the challenges that we experience. So let's start by thinking about the WHO definition of paediatric palliative care. Really key in this definition are some of the things that I've highlighted here. So for example, it's about active total care. Sometimes people say that there is nothing more we can do. And we don't like to use that phrase because there is always something that we can do as we work with the child and their family to try and ensure the best possible quality of life and to enable them to have the best possible end-of-life care and moving into death and into bereavement care. So it's about active total care. It's about the child's body, mind and spirit. We think about providing paediatric palliative care when the illness is diagnosed. We don't leave it just until the end of life care. But if we can see the child and their family early on in the course of their illness, then hopefully we can build up a good relationship with them and we can make sure that they have the best possible quality of life. We've talked about the child's body, mind and spirit, and so that encompasses the physical, the psychological, the social and the spiritual issues, both for the child and their family. It's about multidisciplinary care, and whilst I'm talking today about the role of the nurse needs to be working within a multidisciplinary context. Very importantly, paediatric palliative care can be provided even if resources are limited, and then we should provide that care wherever that child is being cared for, whether it's in the hospital, at home, in a hospice, at school. Wherever the child and family are, that is where we need to be providing paediatric palliative care. So it's about a philosophy of care. It's a philosophy of care that can be applied in different settings. It should be provided across the continuum of care. So when the child and the family are at home, when the child is in hospital, maybe when they're at school or within the hospice, so across the continuum of care. It should be provided, as I've said, from diagnosis through into end-of-life phase and into bereavement. And really importantly, we're there to support not just the child, but also their family, their brothers and sisters, their parents, their grandparents, all of those who are important to them. Paediatric palliative care must be an integral part of the care that we provide. Often, at the moment, paediatric palliative care is seen as an optional extra, and yet it must be an integral part of the care that is provided for all children and young people. And really importantly, paediatric palliative care is about living. It's about ensuring that the child and their family, but the child has the best possible quality of life, that they are able to live as well as possible right up until the time when they die. So paediatric palliative care, yes, it is about end-of-life care, but more importantly, it's about living. It's about ensuring the child and the family have the best possible quality of life. So why do we need paediatric palliative care? Well, there's been work done globally to look at the need for paediatric palliative care around the world. ICPCN did some work with UNICEF and then globally looking at this need, and we identified that there were over 21 million children that need access to palliative care around the world, with over 8 million of those needing specialist care. Other work has been done across the years with different numbers coming up. But the key thing is that there is a great need for paediatric palliative care around the world. And when we estimate that 21 million children need access to palliative care, yet only around 5 to 10% have access, there are millions of children and their families suffering around the world when they needn't be, because we can provide paediatric palliative care. So it's really important that we look at how we can develop paediatric palliative care and advocate for paediatric palliative care around the world. So at ICPCN, we have done some informal mapping exercises, and this is just to show you some of the developments around the world. Back in 2013, this is the map that shows the provision of children's palliative care globally, with the dark green countries being those that have the most integrated and most well-developed children's palliative care. And the countries here in white are countries where there was no known children's palliative care activities. And then as the green gets darker, then the services become more developed. So you can see there are many countries back in 2013 where there was no known children's palliative care services. If we look ahead to 2019, this is looking a bit better, but still we have a long way to go to ensure that every child around the world has access to palliative care. We're just finalising our mapping for 2023, and again, we've been able to see the developments around the world in children's palliative care. If we think about Europe and if we think about the Czech Republic, work has been done by the European Association of Palliative Care in their Atlas of Palliative Care across Europe. And there was two things I wanted to highlight for this talk. The first was looking at palliative care integrated into medical and nursing schools. And you can see here the list of countries where palliative care is included in the medical schools, but also importantly in the nursing schools. If we want to look at the role of the nurse within paediatric palliative care, we need our nurses to be trained on palliative care. We need every nurse, when they are trained, to have something about paediatric palliative care, so that every nurse has a basic understanding of the need for paediatric palliative care and the difference that paediatric palliative care can make. If we then look further into the Atlas, they identify work undergoing in each country, and this is for the Czech Republic, and you can see that there is still a need to develop paediatric palliative care services here in the Czech Republic. Things are happening, things are moving, and it's exciting to see the work that is being done here. But we need to continue to promote and develop paediatric palliative care in the Czech Republic, but also more broadly in Europe and around the world. So let's just for a moment think about which children need access to palliative care. And this is important when we're thinking about the nurse's role. So this is a pie chart from the Global Atlas for palliative care, and this shows the spread of children. And you can see here from this pie chart that over 30% of children that need palliative care due to premature birth and birth trauma or congenital malformations. So there is a big need for paediatric palliative care in the neonatal units. And it has been encouraging to speak to people working in the neonatal units here and to hear about how they are integrating palliative care into their work. Across the world, nearly 30% of the children that need access to palliative care have HIV, although the need is greater in sub-Saharan Africa than it is in Europe. But then there are a wide range of other conditions. Yes, you've got the malignancies, the cancers, but also those children with lung disease, with renal failure, with diseases of the liver, with degenerative diseases. So there is a wide range of children who need access to palliative care. This is some work done in the UK by Together for Short Lives, and they identified 4 different groups of children needing access to palliative care. Those with life-threatening conditions for which curative treatment is feasible, those with conditions where premature death is inevitable, those with progressive conditions without curative treatment options, and finally those with irreversible but non-progressive conditions causing severe disability, which leads to susceptibility to health complications and likelihood of premature death. So this is a wide range of groups of children who need access to palliative care. So when we're thinking about the nurse's role, it's not just about the nurse's role in cancer care, but across the spectrum of conditions with children have, which are life-limiting and life-threatening. But we also know that there are many barriers towards the development of paediatric palliative care. These are just some of them. There's a lack of recognition of the need for paediatric palliative care. I have spoken to ministers of health who have said they don't need paediatric palliative care because their children don't die. That's a challenge for us. We need people to understand that there is a need for paediatric palliative care. There's a lack of policy to guide the development of paediatric palliative care. How is it going to be integrated into our health services? There's a lack of access to education, to treatment, to trained professionals. Perhaps people fear the use of opioids and strong analgesics. And in many places, there is a lack of resources. So there are challenges for us as nurses to overcome. But if we just think of some of the principles of paediatric palliative care, which are key to us in our role as nurses. So we need to provide palliative care across the age range, from neonatal through into young children, school children, adolescents and young adults. So across the age range, across the continuum of care we've already talked about. But it involves pain and symptom management, emotional support, social support, spiritual support, end-of-life care, bereavement care, communication. Communication is key. And for us in our role as nurses, how we communicate with the families, how we communicate with the child is so important. Obviously, it involves the family and significant others. There are many financial issues, and we know that often families with a child who needs palliative care often get further and further into debt or into poverty. So how can we support them in that? And as we've mentioned earlier, through the WHO definition, teamwork is essential, and our role as nurses within that team is key. So it's across the age ranges. It's the neonates, the young children. What about the toddlers? What about those teenagers, the adolescents? And provision of palliative care can be very different if you've got a child who has a life-limiting, life-threatening condition from birth and has been in and out of hospital all their life, to perhaps an adolescent who has been fit and healthy and suddenly diagnosed with cancer. So we need to make sure that the care that we provide as nurses is really key and appropriate for the individuals that we are caring for. We talked about the fact that palliative care should be from diagnosis onwards. This is known as the bow tie model of palliative care, and it clearly shows that we start with provision of palliative care at diagnosis or even before diagnosis. Some children might never get a diagnosis. And as the child goes through their treatment, whether it's treatment aimed at cure or palliative treatment, then the role of palliative care changes. And as we move towards end-of-life care, then the role of palliative care increases. So I like this model because it really shows how palliative care should be integrated from the start. Another thing for us to think about is that I said earlier, every nurse needs to have some understanding of palliative care. Every nurse working with children will come across children who have a life-limiting or life-threatening condition. Yes, we need specialists, and we have specialist palliative doctors. We have specialist paediatric palliative care nurses. But often the majority of the care given will be given by the nurses working on the wards, working in the community, with only a small input from the specialists when things become challenging. And so we need to make sure that all nurses know about children's palliative care. So let's just think about the global context as we think about our role as nurses. Globally, paediatric palliative care has had much emphasis in the last few years, with the World Health Assembly resolution back in 2014, with the Lancet Commission report on alleviating the access abyss for pain and palliative care, with work on universal health coverage, with work on primary health care. Both universal health coverage and primary health care have palliative care as a core component. So if they're not providing paediatric palliative care, then we're not providing the full range of primary health care, or we're not providing universal health coverage. That is important to us as we think about advocating as nurses for children's palliative care. And within the global nursing agenda, the International Council of Nurses, the World Health Organization have also published many reports in the last few years focusing on the important role of nurses and how as nurses we need to be leaders in our field. So important within children's palliative care. So I believe that nurses are at the forefront of the integration of children's palliative care into all levels of care, because we want every child who needs access to palliative care to be able to access it. We as nurses are in a unique position that provides us with opportunities to show leadership, diversity and innovation as we shape children's palliative care around the world. This is a picture of the pioneer of palliative care, Dame Cicely Saunders. This is a picture of her that was used at her Thanksgiving service, a picture of her as a nurse. Now, Dame Cicely trained as a nurse, she trained as a social worker, and then she trained as a doctor. So she was the multidisciplinary team in one. But importantly, it was her as a nurse that was shown in the service for her Thanksgiving. Her role as a nurse was recognised. So nurses and paediatric palliative care is often spearheaded by nurses. In many countries, there are not many doctors, and nurses have a key role. We are pivotal to the guiding and shaping of children's palliative care. We are pivotal to the care being provided to the children and their family. We're also key in ensuring that the care that we provide is both affordable, culturally appropriate, and available for all. So what are our goals as nurses working in paediatric palliative care? Well, there are many goals, but to me, these are 4 things that always stand out. To help our children and their families achieve the best possible quality of life, managing the child's symptoms, speaking with the families, enabling them to have the best possible quality of life throughout the life of their child. To try and relieve their suffering, body, mind, and spirit, the suffering of the child, but also the suffering of the siblings, the suffering of the parents and family. To care for them with competence and compassion, and to respectfully accompany the child and their family on their journey, whether that journey is one to cure or whether that journey is one to end of life into death and bereavement. So we have key roles as nurses. One of my colleagues from South Africa, Dr. Liz Gwither, said many years ago, South Africa may not be a resource-rich country, but as a result, we are extremely resourceful. Now, around the world, nurses, we need to be resourceful. We need to be innovative. We need to think outside the box. We need to recognise our differences. We need to recognise what brings us together. We need to recognise our role within the multidisciplinary team as we shape and develop paediatric palliative care. So there are a wide variety of nursing roles, and I'm just going to take us through a few of these briefly. But as we start, I want us to think about the factors affecting the nurse's role. What is the status of nursing in your country? Because that can really impact our role. As a nurse, I have been teaching in different countries, and I have been in countries where doctors have literally turned their back on me when they've heard that I'm a nurse. So what is the status of nursing in our country? Are nurses respected? Is the views of nursing valued? That will impact our role within paediatric palliative care. Do we have access to the wider interdisciplinary team? Are we working together with others, or are we very much alone as we're working in the community? And what about training? Do we have training on paediatric palliative care? Have we got the level of experience, knowledge and skill in children's palliative care that we need? Also, there is an issue around task shifting in many countries. So Often the traditional role of the nurse has changed. Some of our activities that we traditionally associate with nursing may be fulfilled by community volunteers or other health workers, nursing auxiliaries, by untrained individuals. At the same time, as nurses, we might be taking on wider roles than traditionally we would have had. So, for example, these are just examples of community caregivers, where in many parts of the world, particularly at home, the community caregivers will provide the care for children and their families. But they have a crucial link with us as nurses. We need to be communicating closely with them. We need them to come to us when there are challenges for the child and the family in the community. We need to be able to go to them when we are sending a child home to the community. So they have a key role. Nurse prescribing. In places like Uganda, nurses prescribe morphine and other medicines. Without that, we can't get access to children's palliative care across the country. So these differing roles are really important. But we need to be working as a team. We need to be working together to ensure that children's palliative care is available. We need to make sure that the voice of the child is heard, that the voice of the family is heard. Often we have a role of coordinator. Now, it's not always the nurse who coordinates the care, but it's really important that there is somebody who is able to coordinate the child's care, to help the family navigate their way through the health system, to make sure the child and the family get the care that they need. And this is really important because often families are in a strange environment. Often their child will be seen by many different health professionals. So they need somebody, and it is often, not always, but it's often the nurse who fulfills that role as coordinating their care. Helping in decision-making and developing advanced care plans. Advanced care planning is really important. And as nurses, we have a key role in communication. We have a key role in talking with the family, in providing support, in ensuring that the family and the children, as appropriate, are fully informed and understand any decisions that they're making, providing ongoing explanations and information, and then protecting their rights to decide and to change their decisions through patient advocacy. And one of the things we're very good at often as nurses is advocating for the children that we see and their families. We often have a role as teacher. In many instances in children's palliative care, we might well be teaching the family to care for their child. We might be teaching other health professionals. So we need to be skilled and competent in order to do that. We also have a key role as a nurse as researcher. It's important that we have good quality nursing research in children's palliative care. It's an important part of our role, and our practice should be evidence-based. Sometimes we might well be a consumer of research, so using the evidence, but sometimes we might well be involved in actually undertaking that research. And there are so many areas of research in paediatric palliative care that are needed. This is just an example to show you that the one in blue at the top here, this is research in palliative care. The one in green is research in palliative nursing, and the one in red is research in children's palliative care. So you can see we need more palliative care research in children's palliative care, and we need more nursing research. The nurse as advocate. As I've said, we are good at advocating for our children and their families. What about advocating for our own role as nurses within paediatric palliative care? What about advocating within our hospitals, within our regions, within our countries? As nurses, do we have a voice? Are we being heard? I've been lucky enough to be involved in advocacy at a wide range of levels. So nationally, working to develop children's palliative care in the national agenda with governments. Regionally, working to increase access to children's palliative care, access to opioids. And then internationally, working with the World Health Assembly, working with the World Health Organization to look at guidelines for access to opioids, working with Dr. Tedros, the Director General, in terms of increasing access to children's palliative care around the world. As nurses, we have a key role. We need to have that voice, and we need to use that voice. Therefore, we have a key role as leaders. We are key in setting the direction for paediatric palliative care in our health settings, in our countries, regionally. We have a role leading our multidisciplinary team. It's not always the doctors who lead the team. As nurses, as we have that key role within the team. As leaders, we can be innovative. We can think outside the box. We can help set direction for the development of children's palliative care, making sure the voice of the child and their family is heard. Really importantly for us as nurses, we need to think, along with all these roles, our role with the child and the family, being close to the child, observing, responding, reporting on the child and how they are doing. We need to have skills in assessment and management of pain, symptoms, emotional, spiritual needs. Providing emotional care, providing spiritual care is a core part of the work that we do. We might not be specialists in those areas, but at 2 o'clock in the morning when the child can't sleep and is in the hospital ward, it is the nurse that the child will speak to or the nurse that the family will speak to. So communication is key. But we also need to know our limits and our boundaries and refer appropriately as needed. We must be a skilled educational provider. We need to be able to train others and teach others about children's palliative care. There are many countries, in fact, most countries don't have specialist children's palliative care nurses. Many countries don't have access to education. There are a wide range of online training courses, for example, the ones that we have at ICPCN, which are free to access, webinars, specialist courses. So these days, there is much education available. So how do we tap into that? How do we make sure that we are trained in these areas? Nurses need a wide range of competencies. These are just a few that have been highlighted. Communication skills is key. How do we communicate with the child about their illness, about their prognosis? How do we communicate with the family? How do we bring the two together? We need that excellent assessment to be able to assess the issues for the child and their family. Obviously, pain management, the use of play is key in children's palliative care, caring for the dying child, providing that emotional, spiritual care, and supporting the families in terms of loss, grief, and bereavement, and the child in terms of their anticipatory loss. These are just some of the competencies that we need as nurses. And work has been done, this is through the European Association of Palliative Care, to look at the competencies needed for paediatric palliative care. This is multidisciplinary, and in line with the World Health Assembly resolution, it looks at education in terms of 3 levels: the palliative care approach, general palliative care education, and then specialist education. And this is helpful in looking at the development of paediatric palliative care education for nurses. In the UK, they've looked at education specifically from a paediatric palliative care perspective, not just for nurses, but again across the team. And they have actually identified 4 different levels of education that is needed. And they've gone through the different competencies, looking at the learning outcomes, looking at indicative content, and looking at ways of assessing. So this work is there, and this is being adapted for an international audience at the moment. So work is there, and we can draw on that and build on that. So I just want to give a couple of examples. This is Rachel House in Indonesia. They have a nurse-led program. Their program provides home-based palliative care. They have a community network in palliative care. They provide palliative care training and education, and they provide advocacy and social outreach. They are a nurse-led paediatric palliative care program, and they are doing great work within Indonesia. Another example, at Malago Hospital in Uganda, we have a linked nurse system where we have trained nurses in every ward, in all the paediatric wards, on palliative care. So they can provide some palliative care, and they can identify when issues become challenging and they need to refer to the more specialist providers. and then some work that's been going on at St Christopher's Hospice in the UK, is the development of the Lantern model, which is a new model of nursing for palliative care, and importantly, both for adults and paediatric palliative care. And they're looking at some of the core competencies, some of the core outcomes for us as nurses within the palliative care context. But there are challenges for us as nurses. How do we recognise the complex needs of children and their families? How do we provide a service that puts the child and their family at the centre of the care that we provide? How do we meet their needs? How do we get that balance between cure versus care? What is the best model of paediatric palliative care provision for our setting? Many people have a fear of providing palliative care to children. They don't want to get it wrong. They don't want to say the wrong thing. They have a fear of the use of opioids. How do we reduce that fear? How do we enable people to feel comfortable? How do we enable nurses to feel comfortable in providing palliative care? I've mentioned the status and education of nurses, and that will vary in different countries. And also, we don't want to be seen as giving up. And it's really important that we remember that provision of palliative care is not giving up. It's about ensuring the best possible quality of life. It's about living. We talked about the Lantern model, and this is also the Global Palliative Nursing Network. So if you are interested, you can log into the Global Palliative Nursing Network. Membership is free, and you can hear from nurses around the world as they develop paediatric and adult palliative care. But just as I come to a close, some tips from me. Be yourself. You can't be anyone else. You are you. You are uniquely you. And as a nurse working in paediatric palliative care, you have your own unique skills. Be yourself. Don't try and be anyone else. Never underestimate what you are doing. The lady in this picture here was one of the students on one of the first courses in paediatric palliative care that I taught back in 2001 in Uganda. About 8 years later, here she was as the Minister for Health. So you never know who is in the audience. You never know who you are talking to. There is so much work that we can do as nurses, working within the healthcare system, working within paediatric palliative care. Let's think outside the box. Let's think about how we can be innovative, how we can make a difference. I'm a nurse. I'm proud of being a nurse, and I'm passionate about the role of nursing within paediatric palliative care. How can we make sure that the voice of nurses is heard? And then just a plea really for all of us is to look after yourself in this field. As nurses, we are good at looking after other people, but I think generally we're less good at looking after ourselves. So let's make sure we do things that we enjoy and we look after ourselves. So I've talked about the many roles of the nurse, and one of the key areas is that of the nurse of advocate. This is another picture of Dame Cicely Saunders, and at her Thanksgiving service, Dr. Robert Twycross said, "We too must not just talk the talk, but like her, we must walk the walk and stay the course and continue the task of changing the world." Maybe we won't change the world, but as nurses, we can change the care that is provided for children with life-limiting and life-threatening conditions. We can have a voice in the development of paediatric palliative care. For some of us, yes, we are trying to change the world, but as nurses, we can and we do make a difference. Nursing is at the centre of the provision of paediatric palliative care. We do make a difference. We have a voice, and I would encourage all of us as nurses to use that voice. We can work together to develop and influence paediatric palliative care development. We can work together to make sure that more of those 21 million children around the world who need access to palliative care can get palliative care. We can make a difference. We can use our voice to increase access to paediatric palliative care in the Czech Republic, in our own countries, in the region. We need to work together to do this. We need to collaborate as we move forward in influencing the development of paediatric palliative care. In order to do that, we need to step outside of our comfort zone. I stepped out of my comfort zone by moving to Uganda many years ago, and I have learnt so much, and I have developed so much by having done that. We need to step out of our comfort zone. We need to do something different. We need to take that step. We have a phrase that we often use: if you think you're too small to make a difference, try sleeping with a mosquito. When you go to bed and there's a mosquito in your mosquito net, it makes a big difference. It keeps you awake, you get bitten. If you think you're too small to make a difference, don't. Each one of us makes a difference. Each one of us makes a difference to the lives of the children and their families that we are caring for. Each one of us can make a difference in the development of paediatric palliative care. This was the first young girl that I cared for nearly 30 years ago, the first young girl that I cared for with cancer who died. I learned a lot from her. I have never forgotten her, and as I develop palliative care, as I try and support the development of palliative care around the world, I think of what I learned as a nurse from her, all that she taught me, and all that I learned I take into the work that we do. Because we want to make sure that every child around the world and their family who needs palliative care has access to it, regardless of where they live, regardless of what condition they have, regardless of what gender they are, what nationality they are. Every child should have access to palliative care. And as nurses, we can help move forward in that vision. Thank you.